Welcome to the Doctor's Corner with Dr. KLINE and JONELLE ELGAWAY. Okay, Call Nation, you've been waiting all week, and here they are, Dr. KLINE and JONELLE ELGAWAY.
Good evening and welcome to the Doctor's Corner on KLINE Network for your daily dose of truth with co-host Dr. KLINE and I'm JONELLE ELGAWAY. Today is July 9th, 2019. Tonight's topic is post-traumatic stress disorder or PTSD due to the undertreatment of pain. There are two ways to listen into tonight's program through our website www.cawnation.com or YouTube channel The Doctor's Corner where you can live chat with the audience. Please make sure to click and subscribe to all our KLINE Network's YouTube channels. If you'd like to become a part of KLINE Network and volunteer, or you have future mailbag questions for Dr. KLINE, please email them to janelle.elgaway, E-L-G-A-W-A-Y, at caw360.com. Again, tonight's topic is on post-traumatic stress disorder, or PTSD, due to the undertreatment of pain. We have a few people calling in to share their personal experiences, to include Dr. Mark Ibsen. If you have questions or comments on tonight's topic, or you'd like to share your experiences with PTSD, please call in studio line 415-403-2715, and please stay on topic. All right, so before we get into tonight's show, welcome, Dr. KLINE. How are you this evening?
Just dandy.
Is there anything newsworthy that has occurred recently that you'd like to share with us?
Well, I've been following the trial in Arkansas or Oklahoma, I forget where. Johnson & Johnson is being sued for, billions and billions of dollars by the state of Oklahoma because they want the money for rehab. We've seen that before. Reading newspapers back in the 1950s in the New York Times archives, we see all kinds of programs for money for rehab because it always sounds good. Unfortunately, the money that's set aside for rehab seems to dwindle away, unexplained. We don't really know what would happen if the state of Oklahoma got $55 billion, $5 billion, whatever they want. I do know here in North Carolina, when they won the big tobacco settlement, which everybody's looking to happen again, that the state of North Carolina took some of the money and built a tobacco museum. So winning the money doesn't really guarantee what they say. People just like to have a lot of money. Depends on whether it's a state or a person, and the more the better. So the contention is that Johnson & Johnson kind of tried to fool doctors into thinking these pain patches were really good. And in fact, Dr. Kolodny, who's their chief witness, says these pain patches are not good, they're horrible, and they cause addiction, overdose, and deaths in 25% of people or whatever. So he's the chief witness for the state of Oklahoma and is paid $100,000 to be a witness. He's been on there for 5 or 6 days. There is a new witness that the defense is calling to pretty much refute everything that Dr. Kolodny has said. I've listened to much of it, and Dr. Kolodny is pretty much saying that Johnson & Johnson is responsible for the opioid epidemic. But wait, Purdue was really responsible for the opioid epidemic. No, wait, doctors prescribing too much were the cause of the opioid epidemic. No, wait, two guys that wrote a letter to the editor in New England Journal of Medicine in 1980, Jick and Porter, who just happened to observe in records in Boston City Hospital, not very many people were becoming addicted, and surprised, well, they actually started it. And then I read the other day that physician assistants actually started it. And then I heard the other day that nurse practitioners actually started the epidemic. So Dr. Kolodny, the chief witness representing the physicians for restrictions in opioid prescribing, is the chief witness in telling us that opiates are bad, and anybody who sells them, like Johnson and Johnson, is bad and needs to pay a lot of money. And we don't know how the trial is going. Apparently, it's just before a judge. There was a move to try to get Dr. Kolodny removed as an expert witness. I don't know if that's how that's gone. But it's a case worth following, because if Johnson & Johnson is found guilty of causing the opioid epidemic, this is bad news, because then they will pursue thousands of other lawsuits. The opioids will get more of a bad name than they had before, because now it's decided in court they're terrible, so terrible that you have to pay money. Look how far this has gone in the last 3 years. It's amazing. It's absolutely amazing. The stories I hear now, we heard a good story coming out of Holy Cross Hospital in Silver Spring, Maryland. We had a patient from the West Coast come for specialized surgery there. The surgeon did the operation, but wasn't allowed to write for pain medicine. Now, normally, surgeons are responsible for the diagnosis, for the operation, and then for care afterwards. That's been a tradition in medicine forever. So this surgeon wanted his patient to have pain medicine, like most people should have after surgery, but the hospital has this peculiar arrangement, Holy Cross does, where the surgeon is allowed to operate in the hospital. Of course, the hospital cleans up and gets the money for the operating room, but the surgeon is not allowed to write for the pain medicine. Only the doctor hired by the hospital, called hospitalists are doctors who are on salary at the hospital. Only this hospitalist can write, and guess what? He refused. He refused. So the surgeon is beside himself, saying, this is my patient. Please give her pain medicine. And so the guy just walked away. So this is what's happened as a result of people like the PROP organization and their members, who have wheedled their way into the CDC, published an unbelievably inaccurate, biased document, the CDC guidelines of March 2016, and now we are seeing the fallout, because they have given license to physicians and pharmacists not only to refuse to prescribe, but to say, see, I told you, anybody who swallows opiates is a drug seeker and dope fiend. So in the United States of America, the treatment of pain, whether it be after an operation, in the emergency room, or for one of 30 rare painful diseases, there's just no medicines available. And why? Because PROP and CDC tried to convince the country that these drugs don't work, they're evil, they're possessed, please don't take them, you will die or become addicted. Neither of those things is true. Unfortunately, the team at Johnson & Johnson, in spite of me writing them, have it wrong. Because no matter what you do, no matter what crooks you are, you're not going to addict any more than one person per 1,000. And that's something that we're going to write about soon. Our JATH organization, it'll be published on Medium. There really is no concern for the general population becoming addicted. But here they are having a trial and want billions of dollars. It just shows you how much our medical culture has slidden off the tracks. And here we are hearing stories of this woman who had really very painful surgery because it involved nerve surgery. being denied pain medicine because it was hospital policy. So I dealt with a insurance company, Aetna, who denied a patient of mine both of her medicines. And when I got on the phone with the woman, I said, "Are you a pharmacist?" "No, I'm a coordinator." I said, "Oh, okay." So I said, "What's the problem?" She says, "Oh, well, she's on 2 medicines and she never got approval for the other medicine." I said, "What are you talking about?" "She got approval for both medicines last November." "Oh, well, she's never really been prescribed both of these medicines." I said, "No, that's not true. I've written her a prescription every month since last August, and she's doing fine, and she has a rare, painful disease. What are you doing?" So she said, "Well, it's our policy." I said, "I'm not interested in that. I'm interested in my patient and what you're doing to her." The MMEs," I said, "MMEs are out the window. Have you read anything that's going on in the world from CDC itself, FDA, AMA? There's no longer a 90 milligram cutoff. It was fabricated and it's gone. So what other reasons do you have for cutting my patient off while she's in the pharmacy getting her next prescription? And you want me to send in more paperwork? How long is that going to take? We're going to have her, what, sit outside in horrible pain and withdrawing from her medicines?" So I said, "I'm not sending you any more paperwork."
What did they do about it all?
So she said, "Okay, I'm just going to press a few buttons here and everything is fine now." I said, "Thank you." But it took 35 minutes of my time. And, I run an office. So I spent 35 minutes on the phone, which I'm not reimbursed for, in order to assuage the crooks at Aetna Health Plan. I mean, I can't. Why would anybody want to buy Aetna health insurance if this is the way they treat people? This is inhumane. This is worse than the treatment of pets. Not even to send her a notice ahead of time saying, "Oh, you need more paperwork. We're cutting, or oh, we're going to cut you off. Oh, sorry, your doctor didn't get back to us. Too bad." See, then they blame the doctor. This is the day she went in to pick up her prescription. How more heinous, nasty, and cruel can a United States corporation like Aetna, who claims to be a healthcare savior, go to their website and read all the stuff about how wonderful they are. These people need to be brought up on charges. There needs to be an investigation. People who are cut off their medicines for their chronic painful disease frequently go and kill themselves. And when they do, they say, "Oh, too bad." But if a patient in a doctor's office commits suicide, unbeknownst to the patient, the physician is sent to prison. So that's all I have to report for this week.
Alrighty. Well, we have Dr. Mark Ibsen about to come on. I'm going to bring him in here in a second here. Hi, Dr. Ibsen. How are you doing?
Hi, Janelle. Hi,
Hello.
Dr. Klein.
Hello, how are you?
Recovering every day, one moment at a time.
Yeah, it's interesting that you're on and willing to talk about what happens from the physician's standpoint, because we get injured also, like our pain patients. Maybe not quite as bad, but it's up there. A person who goes to medical school 4 years after college, does another 3-4 years internship, sets up a practice, goes through 3 or 4 years establishing a practice, and then gets hauled by the nape of the neck by the federal drug police in front of cameras and horrible newspaper stories. This is a shattering experience. And it's the kind of shattering experience that can lead to post-traumatic stress disease, which we are going to talk about tonight, both with doctors and with patients. basically the worst cases of post-traumatic stress disease I've seen have been in soldiers, who have been put into battle with a lot of rah, 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 and they realize what it's really like when they see their best buddy blown into pieces. And there's also very severe medical post-traumatic stress disease. A good example is women going in for their chemotherapy for their breast cancer, and they get very sick during the infusion of the chemo. And when women approach the clinic, they're sweating and nervous. And as soon as they see the IV bottle, they start to throw up. That's how powerful traumatic events can have on yourself as a person and on your deep part of your body that's in charge of protecting you. When you see a snake, that's kind of post-traumatic stress disease, especially if you've been bitten by one. My little 7-year-old grandson has become panicked around bees and worries that we're going on a trip. He's going to see bees. I said, why? He said, well, I got stung 3 times the other day. So Dr. Ibsen, how has it been for you through this horror of being accused of things that you were not guilty of being basically strung up by mobs before an inquisition? Inquisitions, by the way, from the old Spanish Inquisitions, are trials that are held with a guilty plea already decided on political agendas. These happened in the Spanish Inquisitions back when Rome was running these trials, because Rome had a preconceived notion about what was right and what was wrong. And so they kind of knew ahead of time when they went to hold a trial, this person had to be guilty, and then they always found them guilty. And that's what we're seeing in our country. We're seeing actual inquisitions. And if you study the old Inquisitions, guess what? They're not a lot different. People are branded as criminals. Doctors are branded as criminals if they even touch opiates, much less prescribe them to people. My God, can you imagine that? Prescribing pain medicine to somebody? I mean, don't you realize, doctor, they could die and become addicted? What are you, an idiot? And the CDC told us they don't work anyway. What are you doing? So this is what we're all facing. And I know...
Well, you're triggering me, man.
Yeah, I'm sorry. So do I need to rush out there with some towels for your forehead?
I'm right there.
Oh, God. That's the problem with all this. It really is awful. And I haven't been through it, but I can empathize with patients and with doctors who've been through it, because just lying awake at night thinking the DEA is going to come and raid me for some reason is just a little teeny bit of what I'm going through. I mean teeny, because it hasn't happened. So, Dr. Ibsen, why don't you tell us what you would like to tell us about a physician's perspective about post-traumatic stress disease?
Well, yeah, thanks for the opportunity. And I want to leave lots of time for patients, because they're the ones that are really being traumatized. It's almost like I was an employee at a prison, electrocuting people on death row. It's the electrocutee who's really suffering, and then of course their suffering is over. But the people who have cumulative stress sometimes don't even know how cumulative it is, and so I think I'm not saying my PTSD is any worse than any of the patients. I think they have it much worse, and I want to acknowledge that. But even the case you just talked about, where a doctor's hands are tied from prescribing to a post-op patient, I mean, that's happening regularly. I still have patients call me and ask me to help them with their pain because they can't find it anywhere else in Montana, Montana being a wasteland for pain management now. So it's very painful to see and to witness and to participate in a system that is so, I think the word you used was heinous, and I think it is an assault on the sensibilities of someone who wants to help others to be prevented from helping them and seeing the harm that comes out of it. So in my case, it was sort of like the DEA came to visit me and they said, Dr. Ibsen, you're risking your freedom as well as your license by prescribing to patients like these. And I said, patients like what? And they said, patients who might divert their pain medicines. And I said, well, isn't that everybody who might? I mean, are we to care for patients or police them? Can we do both? No. So it's a shocking development to someone. I'm 64, and I've been a physician since 1980 when I got my medical degree, and I've never been so demoralized and so disgusted with my profession than I have in the last 7 years as I've seen this freight train gain momentum and pummel people, patients, doctors. There's a lot of us versus them going on, and I feel strongly about it that really we all need to pull together in order to fight this demagoguery or well, you know, the inquisitors. The inquisitors generally don't know what they're talking about, and these guys don't either. So,
well,
in a nutshell.
It's somebody on Twitter said, you know, maybe we need to be holding Nuremberg trials, and I thought, good grief, you know, it's these extremists. The more I thought about it, you see, we have ruined lives. Nobody's brought up a number, but we do know that 10 million people have take opiates all the time. I just did a recent Twitter poll and was surprised to find out that more than 90% have identifiable rare diseases. These are not people with, you know, my back hurts, you know, which has never been the problem anyway. So we've got, and we've got 5 different surveys to show what percentage of the 10 million people are being taken off their medicines. And it looks like we have between 5 and 8 million people. And I'm standing behind that figure until it's disproven. 5 to 8 million people. Because 2/3 of the 10 million have been taken off. Half of those completely off their medicines for their painful diseases. And we on this station kind of know what that is, but people out there in the audience, I don't, and most doctors have never heard of you know, chronic regional pain syndrome, adhesive arachnoiditis. I called a radiologist and asked them to review some MRIs to see if it looked like adhesive arachnoiditis. And he said, "What's that?" This is a radiologist, you know, a doctor. You know, trigeminal neuralgia, pudendal neuralgia, both of these are horrible diseases. Chronic.
Pudendal, you're making me cringe.
Yeah, you can't even sit. I had a lady in my office. She came in and I saw her for the first time, and every 3 or 4 minutes she stood up. You know, and then she would sit back down, and she stood up, sat back down, and she had pudendal neuritis. It's just horrible, horrible. By the way, that's what the patient was being treated for at the, quote, Holy Cross Hospital. By the way, this is a large system started by a very wonderful order of nuns, and I think they've probably all been pushed aside. I doubt that any of them are involved anymore. When I was in Eugene, Oregon, the Catholic hospital that was actually run by the nuns, and it was a wonderful place. But I doubt that there are any leading any hospitals anymore. They've been pushed out by people who want to make $1 million a year and then lots of bonuses. And where do the bonuses come from? Saving money. Saving money. How do they save money? Ooh. Picture yourself as a non-physician CEO. So we have all these people with these chronic, horrible diseases being cut off. And now we're discovering that now that they've been reduced and are undertreated, which, by the way, is medical negligence, they've got all these other diseases happening. Post-traumatic stress, sleep deprivation disorder, hypertension. Well, I'm going to do a Twitter poll soon about hypertension. So not only is your life ruined, where you're no longer functional and you're in horrible pain, even though maybe you've gotten over the initial withdrawal, you're in horrible pain. Now you get all these secondary diseases. I mean, can you imagine a worse condition of a human being to be tortured by pain all day long, unable to sleep more than 1 or 2 hours without waking up with pain, and your doctor says, "Oh, you might get addicted." As one person who tweeted said, you know, that's my prerogative. If I want to become addicted, I will consider that. And if you can relieve my pain, you know what? I'd rather be addicted. But we don't ask them because it's the Inquisition. We've taken over. This is the only time that I know of in historical medicine, and certainly in my 45 years, that the healthcare system has become so powerful and so frightened that they're taking over people's care. They are taking medicines away from people without their consent. And that, by the way, is no longer permissible under the CDC itself. From the director of the CDC said, this is not going to occur anymore. You have to have permission of the patients. And the FDA and the AMA all saying the same thing. But you know what? It's still going on. This woman was at Holy Cross 3 or 4 weeks ago. And they've got some, quote, hospitalists going around in charge of giving people medicine. So they got one doctor in their hospital in charge of giving everybody medicine, a doctor who doesn't even know the patient. This is a real serious breach in medical care. This wouldn't happen, I don't think, in any other country in the world.
Well, ironically, what makes that one doctor who has to prescribe medicine, or 5 hospitalists, or however many they have, the interesting thing about that is if you concentrate prescriptions into a few prescribers, it's going to look like they're high prescribers. Those are the ones going to be taken out.
Yeah,
so
that's true.
The hospitalist knows not to write the script because he's got to write 50 that day, and he's going to say, "No, I'm not writing that. I'll be the lead prescriber in the state, and they'll take me out."
You're right. Oh my Lord. So anyway, let's hear from some people. We've been yakking too long.
Thank you. Thanks for the opportunity to share.
Yeah, stay on the line.
Yeah, we'd like to keep you on.
Yeah,
okay.
Stay on the line so we can comment.
All right. So first caller is going to be Jennifer. Good evening, Jennifer, and welcome to the Doctor's Corner.
Hi. Thanks for taking my call. I wanted to call in because I've been a pain patient for over 20 years, seen several different pain professionals, let's just say, and I use that term loosely in some cases, to treat me. And through the 20 years, I have been abused by so many of those pain professionals that it got to a point before my current doctor, who's wonderful, who I love, but before that, it got to a point where my blood pressure was skyrocketing. I had to go on high blood pressure medication because every time I went to the doctor, whether it was the pain doctor or my regular doctor, my blood pressure was just through the roof. I couldn't sleep. I would feel sick to my stomach for a week before the appointment, wondering what was going to happen this time. Were they going to force me to have injections or do the burning of the nerves in my spine again? It was always something. And as a result, it was making me neurotic, I think. And thankfully, I now have a wonderful doctor. But even with him, I don't have any of those same getting sick before I see him or anything. But even with him, I still suffered some degree from post-traumatic stress because I wonder what happens if he's no longer there for me. And, it's such an unfair thing because you've got patients like myself. I have complex regional pain syndrome and a whole laundry list of other things. And we've got so much to worry about without having to deal with high blood pressure because what are we going to do if the one medication that's making us feel better, that's giving us our life back, is suddenly taken away?
So in other words, your post-traumatic stress, which basically is following a traumatic experience, you then begin to physiologically anticipate the next one. So in other words, sweating, not being able to sleep, high pulse rates, high blood pressure, So is that kind of what happened to you before when your next appointment was due with the hatchet man?
Oh, absolutely. I mean, I have trouble sleeping anyway. I still have trouble sleeping, but I mean, I wouldn't sleep. I would be up all night the night before going because I was just so keyed up. And after the appointment, depending on what they did, I would be miserable for days because my whole body was just all tensed up and trying to relax again after whatever procedure they made me go through, or whatever, the cut in medication, or whatever it was. It's like a cat hanging from their nails from the ceiling, looking down, wondering, okay, how long am I going to be able to hang here before I can't anymore? And I go falling to the ground. It's that kind of feeling.
Yeah, and by the way, there's a Canadian pain scale from one of the universities. They rank chronic regional pain disorder as the highest possible pain disease, higher than the considered to be the maximum, which is giving childbirth without anesthesia.
It's the McGill pain scale, right?
That's it, the McGill. Yep, from McGill University. So, and doctors don't know anything about this disease. So one of the things that I've been thinking about is we're going to try to put together a little book with descriptions of these rare painful diseases, a little medical blurb, and then a couple of blurbs from patients. But in the meantime, if people are out there dealing with their rare painful diseases that doctors don't know about, type up a little description. Go to Wikipedia, which I'm sorry everybody says is terrible. It's not terrible at all. It's a very good resource, and they have references. So get a little blurb together about here's what the disease is, bullet point, bullet point, bullet point. And then here's what the disease is like for me, bullet point, bullet point. See if you can squeeze it onto one page. And say, doctor, I just, do this in the mail. Never do this in front of a doctor in the office because they don't have time. They got 8 minutes to see you. And if you hand them something, they're going to feel frustrated because they don't have time to read it. Send it in ahead of time, either the U.S. mail, which I prefer because when they open a letter in the office, they will stick it in the in basket and the physician will read it. And and then add a little letter about what it's been like for me. And don't talk about how much pain you've been in. You talk about, when I have my arms swell up or my, you can say when I have this terrible discomfort, here's what I can't do. Here's what happens to me as a person. What it's like to not sleep for one night's bad enough. How about if you couldn't sleep for 2 weeks? The effect that it's had for me. And you make it like you're a court reporter. You're just giving the facts. Don't put anything emotional in there because they think, you're just some emotional woman if you got a male doctor. And I'm sorry, that occurs a lot. And 70% of people with rare painful diseases are women. So I think it's a women's issue, quite frankly. So, all I can do is apologize to you for the medical profession. Not that that's a big help, but Bill Clinton, apologized to African Americans for all the crap that they put up with for 200 years, and it made a difference. So as a physician, I really am sorry that this happened. We are going to continue to work on trying to fix things. We're going to give doctors a chance to make more money seeing pain patients. There are some doctors who have finally thrown up their hands and saying, I'm not going to send you to this pain clinic anymore. I'll just take care of you. One person wrote in and said, DEA be damned. I'm going to treat you again. So it's starting to break a little. I think people that did actually go to medical school, like Dr. Ibsen, who really kind of felt like it's our job to help people out with the skills that we have. There's a lot of lawyers that feel that way. There's a lot of veterinarians that feel that way. There's a lot of dentists that feel that way. They became professionals in order to provide a service to people and help them out, I felt real good when my tooth exploded, and there was my dentist ready to see me a few hours later. And, so it's nice to have professionals around that can help you. But, people like Dr. Ibsen, who I've read a lot about Dr. Ibsen, aside from the things he's told me. And I can tell you, this is one of these kind of rare doctors, that really does care for their patients and really is trying hard. And he tried to pick up the slack, after people were kicked out of practices. So he had a rescue practice and he was punished for it. And hopefully someday we will have a hearing about people like Dr. Ibsen, maybe a Nuremberg kind of hearing. Where the Nuremberg Trials were legal proceedings and saying, what'd you do this for? And could you confirm to us that you actually did this? And did you have a reason for it? It was, it was a regular trial. And some people that were accused were innocent and they let them go. But this has got to happen. And, we have a change in the United States House of Representatives. And we have Dr. Elijah, our Representative Elijah Cummings, who's one of the finest people that ever lived, and a true statesman, a true professional, like we're talking about. And that committee he runs, the House Committee on Oversight, is where these kinds of things come up. And there's been a little bit of activity already. So we'll keep our fingers crossed, and we're all kind of sitting around, ready to go. But Dr. Ibsen's right. Doctors need to get together, and if they want to sit around with their hands over their heads under their desks, you don't have my respect. So, right. Jen, thanks. That's thanks, really Jennifer. An awful story. But it seems to be going on a lot. This seems to be a common problem.
And Jen, this is Mark Ibsen again. I want to apologize to you, too. This is the first time I've ever heard anyone else apologize to patients. And thank you, Dr. KLINE, for that. Patients need to hear that they've been harmed, and they need to have somebody in a white coat say, I am so sorry this has happened to you. It is not fair. It is wrong. It's immoral. We're doing what we can to reverse it. In the meantime, we're in the same lifeboat with you, and we care. And even though if our hands are tied, it's still very important for us to acknowledge the harm that's happening. And so thank you, Dr. KLINE, for acknowledging that. It is a profound thing for patients to hear that.
Yeah, well, there's two of us, and there are other physicians, who feel the same way, and we're trying to form a little group because groups are the only way things work. I write these wonderful articles that my mother loves and everybody loves, and they're just useless, because the wrong people are reading them. So we need to gang up. One thing that did work was the petition organized by Sally Settle and others. 200 people signed it, and this is what made the CDC buckle. Not individual articles, it was a petition. It was brilliant. And so we're going to try the same strategy so that people know and courtrooms know that there's a practice of standard out there that's not made up. So, Joe, another caller?
Yes. Next caller is Jeff. Welcome, Jeff, to the Doctor's Corner. How are you this evening?
I'm all right. Hi, Janelle and Dr. KLINE and Dr. Ibsen. I just want to take a minute to thank you when I had the chance. I've been following you online, and I just really want to say thank you for everything that you're doing for us pain patients. Really, Dr. KLINE, Dr. Ibsen, and the doctor in Las Vegas whose name slips my mind are really the only three I can think of.
Dan Laird?
Yeah, Dan Laird.
Yeah. You're really the three wise men. So just thank you for everything that you've done for all of us.
Sure.
Without y'all, there's no telling how much worse it would be. But anyway, about my experience with PTSD, I guess I should preface this by saying that, I was in the military and did work with the intelligence community. So, I have PTSD stemming from that, just from the horrible things that I've seen and done, in service to the country. But that pales in comparison to the PTSD that I have from my experiences trying to get help with pain. And, it would be a typical experience to a doctor or an emergency room. You walk in, and the second that it becomes clear that you're there for pain, you can see their eyes glaze over. And it's like they go into this hunter-killer mode of trying to ensnare you, through all these little mind games about, well, you don't look like you're in pain. That's the number one thing. You don't look like you're in pain. You're sitting out in the waiting room on your phone, and nobody in pain would be on their phone. What else have I heard? There's a thing where if you happen to know the name of a medication, you're automatically a drug seeker. It couldn't possibly be because you've dealt with this pain so long that you know the names of drugs. The second you name any pain medication by name, then you're automatically a drug seeker. And I can't think of any other instance. If I went in and told a doctor, I have high blood pressure and I take lisinopril hydrochlorothiazide, or metoprolol, or any other drug, they're just going to say, oh, it's a well-informed patient. But if you're a well-informed patient when it comes to pain, you're a drug seeker. And just that experience of walking in and having that treatment, because, you go to a pain doctor and you're at your most vulnerable. You're a patient in need. You're a patient in pain. And you're bringing yourself to this doctor and you're saying, here I am, I'm broken, not really fix me, because a lot of times there's no fixing, but at least help me, do what you can to relieve my pain. And instead of a doctor fulfilling that role, instead they take on the role of a cop, I guess. And, it turns into a trial. And it's horrible. And for the longest time, even if I'm going to a doctor just for a non-pain issue now, a lot of the sickness and just anxiety starts welling up in me. Just, it's like a Pavlovian response now. You go into a doctor's office and your heart starts racing, and it's horrible.
Yeah, that's a good Pavlovian is part of the post-traumatic stress disease. In other words, it's something that you don't have a lot of control over. It's like seeing a snake. So you're going into the office and you're going to see another snake. As soon as you get the smells in the office, you see the front door of the office. If you've had traumatic experiences in there, you have post-traumatic stress. I'm involved with a person that I talk to and email who is in such serious post-traumatic stress she cannot bring herself to go get labs because she just doesn't want to get anywhere near doctors, hospitals, labs, whatever, and it's affecting her health because she needs to get these labs because she's got a couple of illnesses that require lab confirmation and follow-up. But here she is, she just can't go, and so she just gets worse and worse. This is death by torture. This is Guantanamo.
It really is.
This is Guantanamo Bay, only it's worse because in Guantanamo Bay, they drag people out for 3 hours and torture them. Then they go back to their cells and relax. But this woman is suffering 24 hours a day. It's hard to imagine being suffering 24 hours a day. And I have to say that, 70% of people with rare painful diseases are women. And the women that I've talked to, they've just been heroic. I mean, these people need Medal of Honor, for putting up and trying to continue having a life for themselves and their loved ones. It's just phenomenal. And the newspapers do tell these stories. Go ahead.
I was going to say, at least with Gitmo, at least there's a UN watchdog group, keeping tabs on these prisoners. We don't have that.
Right.
We really don't have anything except a medical community and really most of the media that are convinced that they're in the right and we're in the wrong.
Well, and it's an hysteria. It's truly a mass hysteria, much the same as the hysteria with the witch trials that I'm still studying to try to find parallels. But it's very, very similar. People were so frightened that they were going to lose control without any preparation or knowledge. In other words, the devil would silently get into their souls without them knowing it. And look at the parallel we have. You come to the emergency room, you're taking pills, you're possessed. And so, you know what happens when you're possessed? You can spread it. That's what witches do. They become possessed themselves, and then they go around possessing other people. I think deep down inside, the people in the emergency room are basically frightened of you coming in on medicines and that you're going to somehow affect their lives. Maybe it's people like you who take these medicines that cause that nice football kid to kill himself or die from heroin. It's people like you. So you see this kind of nebulous. It's different for other drugs. Amphetamines and cocaine are much worse drugs because they change your personality. And actually, the number of people involved with these things is much higher. But yeah, we don't hear anything about that.
It's funny you mentioned that too, because that bewitched mindset when it comes to opioids, that seems to be the mindset now, is that just mere exposure to these medications, that if they give it to you one time in the ER for a broken bone or something, you're hooked and you're already going down the road to disaster.
And then you're going to become harmful. Go ahead.
Yeah, my wife last year had lap chole. She had her gallbladder taken out, and her post-op pain treatment was dismal because they're so afraid of just what used to be the standard of pain care. Now, like it's going to infect her, like it's anthrax or something, that they won't even properly treat acute post-op pain because they have it in their mind that, just
they're not supposed to do it.
These medications is dangerous.
Yeah, it's getting to the point where medical professionals and nurses and nurse practitioners and PAs are don't think that they should be doing this. It's kind of like back in the days when they were sterilizing people with developmental delays. A lot of doctors did that. They didn't care, but it's kind of like we shouldn't allow these people to reproduce. It's the same kind of thing. We shouldn't really be doing this. And of course, the CDC, keep saying it over and over, they made it a lot worse by saying that these drugs don't even work. So now people are thinking, wait a minute, I shouldn't be doing this, and these don't work. So why in God's name would I write a prescription?
Well, didn't Andrew Kolodny also state something about how, we have to wait until this basically era of this group of people, the baby boomers, are gone until we can get through this? It's going to...
I believe
that's
so.
Horrible.
Yeah, another prop statement from these
waiting
various
for us to
people.
die off.
Waiting for you to die off. Then everybody says,
Exactly.
"Oh, you're just being an extremist." But we've got people at the prop organization saying these things in public. It's the new evil. We've always had evils in this country. Started off with being possessed, then it went to communists around every corner. Then people with HIV, then gay folks, and then black folks. We always have to have something, immigrants, we always have to have something. And now it's turned into a medical issue. People did die during these other episodes. Black folks were taken into the woods and hanged, beheaded. Children were taken away and killed. So we have people dying of suicides, which the prop organization said was bogus. So this is a real serious problem. I just had this. I was lying awake, trying to figure out if the DEA was coming the next day, and I was thinking, I wonder, all of a sudden we just find the United Nations here prowling around and doing a refugee survey for pain refugees, just like they do with refugees in other countries. We've got people in this country that are refugees that can't get health care. They can't get health care. Not only are they not getting pain medicines, they're not getting anything. One of the
it's funny. It's funny you talk about suicide because I think the thing with suicide is there are a significant amount of people out there that are either at the edge of committing suicide because of forced tapers, or they've already committed suicide. And I think the proof is there that they actually want that, tied back into that dying off thing, because if you were to have that amount of people in any other sector of medicine, like if they introduced a new drug and there were the same numbers of complications and deaths as there has been suicides from forced tapers, they'd be putting the brakes on hard and doing something about that. But I'm not seeing that with the suicides that have come up from forced tapers.
I've been in contact with the person who's in charge of monitoring suicides at the CDC, and I said, "Are you tracking suicides from people who were cut off?" And she said, "No." And I said, "Why not?" And she didn't really give me a response. I'm going to ask her again why they're not tracking suicides. We have 40 that we've published on my Twitter, and they are really not bogus. I think to say that people who have ended their lives for medical reasons and call them bogus need to be taken behind the woodshed. And maybe a group of people with painful disease can just take care of them. Now, of course, that's all an allegory, you understand. But yeah, it's really bad out there. And do we have other callers?
We do. Yeah.
Okay.
Thank you, Jeff, for calling. I appreciate it.
Yeah, no, that was very good
you.
insights. Appreciate it.
Yeah, we actually have a bunch. So, the next lady is Colleen. Colleen was going to call in. Just give me 1 second here. All right. Colleen, welcome to the Doctor's Corner. How are you this evening?
I am okay, better than yesterday. So, a little bit not as bad as yesterday, but we'll see what tomorrow comes. As far as PTSD, I guess I can agree with a lot of the former patients that were saying that you go to I was, for one, raised in a healthcare professional's home. I was raised with a nurse, and I was raised with doctors around me all the time, and you always looked up to them like they could do no wrong. And I don't think it was until I hit my 30s or like mid-30s that I realized that doctors are doctors, and they make mistakes just like everybody else, and they are not infallible of making mistakes. And I feel like a lot of times doctors make mistakes to cover their own rear ends when it comes to like the health of the patient or the medicine that they give their patient, because there's no standard. And if like you go back to the CDC and they say, well, the limit for oxycodone is 60 milligrams per day, and that would be safe. Well, 60 milligrams may be safe 10 years ago, but that may not be the case today or for a person that's been on it for so long. And I guess what I get so upset about is you walk into a doctor's office who's supposed to have no judgment of you and is supposed to look at you as like an entity of what is going on, and they focus in on that one thing. And then everything else becomes like a moot point, and it's almost like a cow is in the room and you can't get anything out after that.
So have you had post-traumatic stress from all the doctors that you've been seeing that have turned you down and
Yes.
taken you off your medicine? It kind of makes it
Yes,
so you
like
don't want
to
to
the
see
point.
any more doctors, right?
Exactly. Like, I think I have seen maybe 2 doctors since January, and before that, there was a philosophy of like too many cooks in the kitchen. I had up to 15, and if you put all those meds together, it was up to 35 pills a day
Yeah.
of all these different things. And this was before like they really started to communicate and talk and say, well, hey, I'm doing this and hey, I'm doing that. And the only one that really knew about like the drugs and the interactions that were going on were the pharmacists.
Yeah.
Because
Pharmacists
like
can,
you write it,
yeah. Go ahead.
you write it down. And you say I'm taking this, and then the pharmacist will say okay, and then they'll be like, oh well, the doctor from over at this practice, you might want to consult them. And it's like, wait a second, shouldn't this doctor who I just went to know, since that's in my chart? Well, you're honest with them, and I mean, I know about the whole 8-minute rule. They walk in, they get 8 minutes, and then they walk out. But, like, I mean, I know I was a teacher, and all summer long, all I did was read files about my students and where they were coming from and what they knew and what they didn't know. And I just feel like those paperworks are almost glazed over. Like, okay, let me find out your name and your age and your sex and your birthday, and then that's it. And now I'm going to go and I'm going to do my initial meeting, and it really doesn't do anything for the doctor or for the patient, and it leaves them both in a state of frustration.
Yeah, that's a good point. And I think people with chronic rare diseases need to take different tactics, understanding the doctors are only given 8 minutes. And again, sending in little short letters in the mail, or if you can do it on email about, doctor, I'm getting ready to see you on the 15th, and I just wanted to fill you in, and make it brief, or they won't read it. Bullet points. Colleen, it sounds like you've been through a lot, and appreciate you sharing with us, because I think it's important for other people with rare chronic diseases and all this stuff that's going on to realize they're not alone. I think when you're attacked in the emergency room, you feel like you're the only person there. Nobody's there protecting you. And it's always good to try to take somebody along with you, somebody large and burly, who looks real nasty maybe. It's really impossible to go alone anymore when you have chronic painful disease. I've heard of people going to pain clinics and they take along whoever they wish. And the pain clinic refuses to let the other person in, into the interview room. It's really bad out there. But I still want you all to send in complaints to the Board of Medicine in your states that you're in, or the Board of Pharmacy, because both of those types of boards will look into it. Okay, I got a letter from my board because someone didn't like my Twitter tweets and thought that I should be removed from the practice of medicine. So I got a letter, and the point is that the boards will send out letters. Now, they may not do anything about it, but that doesn't matter. They're being told. And anything that you consider to be unprofessional behavior should be reported to the boards. You go online, you can work on it ahead of time, make it real brief and real unemotional, and you don't use words like very or doctor was an idiot, or just say, here's what happened. Here's the facts, ma'am.
All right, Dr. KLINE, we have about 6 other callers that
okay. Fire when ready,
so.
Gridley.
All right. So caller from
Dr.
area
Ibsen here.
Oh,
yes,
you
Dr.
go ahead.
Ibsen.
Oh, just real quick. If you send anything to your doctor, try putting the return address as a local law firm and write confidential and private on it. They will open it if you do that.
Yep. Okay.
That's all.
Caller from area code 401. Welcome to the Doctor's Corner. What's your name? What's your question?
Hey, Dr. KLINE. Hi, Mark. Hi, Janelle. It's Claudia Morandi. So I wanted to call in super quickly.
Sure.
So whenever I advocate, I always send in letters on my letterhead, and I always put confidential because they always read it. The reason I had the emergency room compassion bill sponsored in my state, it started off as a resolution because so much of this PTSD stems from emergency visits, emergency room visits, the inquisition, the interrogation. And that's the reason I became so forceful in advocacy. I can't stress to these people the importance of documenting everything and leaving the emotions at the door. I advocated for a person today who had to choose between her clonazepam or her daily pain medication. So I sat down as her advocate and, I listened to what the doctor had to say. And then I explained what my role was. And then I explained that the patient is not going to make a choice because she's been stable on both medications for 9 years. And she's never abused her medication. She never sold her medication. She never failed a urine test. And when I was done, I said, so for all those reasons, you're going to hopefully continue to prescribe her whatever, her 1 milligram daily of clonazepam. And when I was done, it was silence. You could hear a pin drop in the room. And I said, I'm going to give you some friendly advice here. I said, because I'm in Rhode Island and because I have this national organization, we can be friends or we can be frenemies. I'm not sure which you would prefer, but I would hope that you choose the first, because if you do not give this woman what you've been prescribing for 8 years, you've now created a situation which will be investigated by the Department of Health. And it's all about the follow-through, and pain patients have to do the follow-through. And it starts with a handwritten letter being sent, and you CC doctors and your medical board, and you CC everybody, and you do leave the emotion at the door because that just gets you in one place. That's trouble.
So you mentioned the emergency rooms were particularly a problem, and you're working on some legislation. Yeah, and I hear this a lot. As a matter of fact, I'll do a little Twitter poll and find out. I had a patient the other day who was on really high doses of stuff for her very severe rare disease. As soon as she gets to the emergency room, they rush over to the police blotter, the computers, and they say, look at all these medicines you're on. You're obviously a drug seeker. And she said, wait a minute, I'm on all these medicines. What do you think I'm doing? Do I want more? I've got enough.
Yeah. That's that's just bad behavior that can be handled with risk management. That's where all of my PTSD stemmed from. For 3 years, I couldn't even drive the side where my hospital was located, that side of the city. Wow. I couldn't look at the back of a rescue. So it really fuels me. And that's why I just started to write a co-prescribing bill, because in Rhode Island, they admitted defeat. They said our biggest problem, people need to have access to these benzodiazepines that they've been cut off from. And, it's making these connections. And it's not hard to start to write a bill. A co-prescribing bill is a must. It's a necessity in every state, because at the end of the day, 60% or more of the population is on either an antidepressant, a benzodiazepine. They're not abusive medications. Millions have been stable on these. And for me, it started with a resolution and it trickled into legislation. And it's not hard to do. But I just wanted to put my 2 cents in.
We appreciate it. And I think, the fact that you've decided to do more than documenting and decrying and do something about it and try to write legislation is a real plus. And hopefully if people have questions about how to write legislation, Claudia's kind of been through it and can kind of give you tips on stuff, things to avoid and blah, blah, blah. It's not easy, but legislators really are there to help out. Everybody has this negative view of legislators like they do with doctors, but they really do want to help. So, Joe, we have another caller.
Me too. Thank you so much, Claudia, for calling in. Appreciate it. Okay, caller from area code 719. Welcome to the Doctor's Corner. I'm having a little bit of trouble doing this. Brian, can you help me out? Oh, sorry about this. All right. My clicker's going slow today, guys. I'm trying to pull in area code 719. All right, there we go. Welcome. What's your name? Hello. What's your name and what's your question?
Hi.
Area code 719. You're on.
Yeah, tell us about your post-traumatic stress situation.
Oh, okay. I guess he went off. All right, let's try another one. Caller from area code 618. Welcome to the Doctor's Corner. What's your name and what's your question for Dr. Klein?
My name is Cindy, and my doctor told me that absolutely nobody else would prescribe for me, and so I'm basically being held a medical hostage, so to speak. And when I tried to call around to other doctors' offices in the area, the first thing they did was ask my name and my date of birth, and the very next thing out of their mouth was, "We do not give out pain medication here. So if that's what you're calling for, we cannot help you." And part of my frustration is that my doctor isn't all that great, and sometimes I want to get a second opinion about something that's not related necessarily to my painful condition, but I can't even get through the front door. It's like I'm stuck with this guy, and he's telling me nobody else will prescribe for you.
Well, that's because they're hitting the national computers. See, that's why they want your birth date, because then they just quick type into the opioid computer. You see, as soon as a person is prescribed an opiate, within 1 minute, it goes on a national computer and it's showing up in Anchorage, Alaska, Denver, Colorado, Los Angeles. Here you are taking these medicines. So what's the implication? You're a drug seeker. Bingo. It's kind of like what African Americans went through. You show up in the, no, we don't have any appointments for you. We're full. So we're going through the same thing that our American citizens who ancestors came from Africa without their permission went through and are still going through. So what do we do about that? What we need to do about it, talk to your legislators about a national computer and a state computer that are labeling you, and they are labeling you for the wrong reasons. They're making money. They have invented a system that pleases the legislators, who then get federal money to pump more into it. So there's a national computer just for controlled substances, primarily opiates. To my knowledge, they don't put Adderall in there. According to a pharmacist that I spoke with, he's filling 3 times more Adderall prescriptions than for oxycodone. So we've got a big problem with these. These are dangerous drugs. Opiates are not dangerous drugs. The people that are addicted have bad behaviors and steal and manipulate and stuff. But so what can you do about that? You've got to do something systemic. In other words, you've got to go to your legislator and you tell them the story. You have a good way of putting a story, and you say, I would like to speak to my local state representative or an aide, and then you just tell your little story. Legislators are there to help solve problems. So they're kind of like going to a doctor, and the doctor helps you solve a problem. That's what legislators do. They solve problems that we can't solve as doctors. And so to hear a story like yours is really compelling. You have a very compelling story and a nice way of telling it. And you're not, real emotional and screaming and yelling like I do. So I would do that. I really would. I would go find out who your rep is, just go online and say, state representatives. And then they usually give you a little map and stuff, and they'll get you to the right person. And you call them up and make an appointment, if they're in session. And just tell them that. Say, I have a problem. I have a problem with my health care. And here's what it is. And it seems to be that having my name on a computer as a doper, because I have to take pain medicine, and remember, always substitute the word pain medicine for opioid. Opioid is a nasty word. It's a word like possessed. Okay? Stay away from the word opioid. Say, I'm taking these pain medicines. Tell them what you have. I always tell people, pick one of your chronic diseases and just stick with that. Don't go rattling off a whole bunch. Just say, I have. And as a result, I need pain medicine because there's no treatment. And here's my story. So go ahead. Don't be shy. They really do like to hear from people. Legislators are not bad people. They like to hear from their constituents because they want to help out and they want you to vote for them the next time. That's okay. So, I hope that you do find somebody. But again, leading in with letters first, so that you haven't got some secretary on the phone who's been instructed to go to the National Drug Computer invented at Brandeis University, where Justice Brandeis was the first Jewish Supreme Court judge, and he turned out to be one of the best, and his specialty was privacy, of all things. And now his university has sold out, took $14 million from the DEA and Department of Justice, developed this National Dragnet computer. So good luck to you.
All right, Dr. Kline, well, I think we're going to wrap up here. I believe Dr. Ibsen is still on. Is he still with us? Maybe not. Okay.
Yes, I am.
Oh,
No,
yes,
yeah,
I'm here.
you are. Yeah, the intrepid Dr. Ibsen.
Did you want to say anything before we get going, Dr. Ibsen?
Yes, but it's time for another show, I think.
I know, right?
just thank you for the opportunity to talk about it. I think we ought to revisit it regularly. People are hurting, and we've got to do our best to support people that are hurting, including our colleagues in medicine, including people who have addictions. There's a lot going on in the Facebook sphere about us versus them, and I plead that addicts aren't being coddled, neither are pain medicine patients, and neither are doctors. We're all suffering under this inquisition, and we need to pull together as a big voting bloc, because the elderly were marginalized until they formed AARP, and the legislators decided that they were a voting bloc and they needed to be listened to. And we need to do something similar. We need a massive amount of voter pressure on our legislators and our regulators so that they stop killing us. That's all.
Yeah, no, good point. And I just have one little fact. I don't know why. It's funny how things don't dawn on you. The 90 milligram CDC attempt to. Do you know how much oxycodone that is? That's 2 30 milligram tablets a day. That's a dose you'd give an 8-year-old. So where were these people's heads when they came up with this number? And who came up with this number? You know who came up with it? Prop. Mm-hmm. Prop came up with it after they appealed to the FDA for 100 milligrams, which is pretty close. And the FDA said, go bury your head. This isn't going to work. You haven't even made a decent case. You've got all this phony literature and stuff. So they just trundled over to the CDC, where Dr. Frieden, who makes similar public statements about things like, pain pills or heroin pills, and they just let them go wild, and they just let them write this stuff, and they came up with 90 milligrams. I don't know why. I just never realized. I always wonder why my patients have such high MMEs is because they're taking normal doses. If you take 2 oxycodone every 4 hours, which is not unusual, you got an MME around 500. My God, you're going to drop dead and become addicted with that. So we need to come up with common sense things that we can ask people, like, isn't it true? I take 2 oxycodone a day. How many people do you think I can get by with that. So anyway, I've gone on long enough. It's time to say nighty night.
Okay. Just a quick, thank you, Dr. Ibsen. A quick rundown for the rest of the week. Tomorrow, 8 p.m. Eastern Standard Time is Keeping You in the Family with host Dr. Margaret Aranda. Topic is topical and regional anesthesia. Sunday, 6 p.m. Eastern Standard Time is DPP Rally Talk Show with Claudia Morandi. She's having guest John Flannery, which is a lawyer, on. And I just want to say a big thank you to our audience for taking some time out of your evening to join us here at the Doctor's Corner on KLINE Network for your daily dose of truth. I'm JONELLE ELGAWAY signing off with Dr. KLINE. Until next Tuesday, have a great evening, KLINE Nation.
Good night.
This has been The Doctor's Corner with Dr. KLINE and JONELLE ELGAWAY. Copyright 2018. All rights reserved.